So I'm going to start now. Good afternoon, Chris. Good afternoon, Dillan and Tage. And this is Dr. Prasad. And I'm going to talk, we are going to talk about the COVID-19, and which is, today we are mainly concentrating on the children. Our previous tapes, records have been the general, and from what myself and Chris, you agree with me, think that this is the top health mental illness in 2020, because this, you agree with me, right?
Absolutely, absolutely. I think it's going to be an emerging story that we're going to hear more and more about as time goes on.
Because this pandemic has involved all over the world, with so much of mortality and so many people sick still, losing jobs, everything. Yeah. So first of all, I will give the introduction. Dillan, are you there, Dillan?
I am here. Thank you for having me, Dr. Prasad. Hi, everyone. My name is Dillan. I'm a college student at the University of Chicago. And I'm here to give my perspective on the college viewpoint and learn from Dr. Shreve and to hear what he has to say.
Sure. And good afternoon, Tage. Can you give your introduction?
Yeah, sure. So I'm a high school student at Bloomfield Hills High School, and I'm really eager to learn what Dr. Shreve has to say. I'm really interested in his perspective about the mental health in children when it comes to the coronavirus.
Good. And Chris, we all know who you are, but still, give us your introduction.
Certainly. Well, for you guys and our viewers, my name is Dr. Chris Shreve, and I am a mental health professional working in private practice and doing consulting and consultation work, also specializing in the area of trauma, substance abuse, and mental health. So I'm glad to be a part of this discussion today, talking about the mental health effects of this pandemic and how it's affecting the psyche of our kids and college students and everyone. So I'm glad to be here.
Amazing, isn't it, Chris? We have done wonderful videos last year, top mental health issues, but this is it.
Well, I think we're seeing history being made, and we're going through something that is an epic time in our lives.
Exactly.
And I think this is something that we're all going to think about for years to come.
Exactly. So I will just take like 4 or 5 minutes in between. I prepared 2 articles, one for the COVID in children specifically, and then the another one is, the New York Times reported this mysterious illness in children, and some of them turn up to have the Kawasaki disease. So later on, I will just highlight all of you about that. But mostly we will just ask first Tage and then Dillan to talk about their issues. So Tage, go ahead and ask him, Dr. Shreve.
Yeah. So one of my questions that I have for you is, how do you think the students, like their work ethic when it comes to like getting good grades in school and whatnot, how do you think that will be impacted by the coronavirus? Like, do you think they're going to be less motivated, or what do you think?
Well, obviously that's going to be student by student, and I think it's a mixed bag of what's going to happen in the fall. I think our goal obviously is to get students back into the classroom setting, but with social distancing and the prevalence of this virus, I think things are going to be very different. So in terms of performance, anxiety, and pressure, I really think it depends on what modality the kid is in. So if a student is in basic K through 12 education and they're in the classroom setting, it's probably not going to be much different, I think. But if we're talking about being online, that could raise a lot of anxiety for kids if they have to stay adjusted to being taught online. We might see a hybrid of some classroom activity and then some online activity. So in terms of how it's going to affect performance and the modality and how students will be motivated, I think it's not going to affect much. I think we really have to make sure that students feel safe in the classrooms, that they feel that they're protected from the virus, if you want to put it that way. And I think those would be the things that we have to really work on, is things that would distract students from performing academically, which could affect, their motivation.
Yeah, thank you.
So that's good. Dillan, you want to ask him a couple of questions as a college perspective?
Sure, sounds good. Thank you. Dr. Shreve, I actually was hoping to take a more conversational approach to this, to learn from your expertise, particularly with respect to energy and energy medicine. I looked through a couple of your bios and saw some materials online, and it seems like you have this novel approach to mental disorders, and more specifically, trauma therapy and new therapeutic measures. So, as everyone knows, as I'm sure you know, depression is the leading cause of disability worldwide, and anxiety has reached an all-time high, whether that be because of diagnosis, prevalence, right, or because maybe things are changing in our social sphere. And then other psychoactive diseases, such as or conditions such as ADHD, are prevalent as well, especially in America these days. So I think that we're really going through an era where mental health disorders are becoming more and more prevalent, especially on the stage of public discourse. And I'm sure that the traumas and the crises that this COVID-19 is causing shouldn't be looked over and shouldn't be ignored. So first I wanted to just ask you, do you think that COVID-19 and all of its associated effects in society, particularly American society, has a capacity to cause increased prevalence levels of these mental disorders such as anxiety, depression, et cetera, et cetera? And then second of all, how do you see us as a society approaching that and combating that, maybe with respect to your own ideas and your own therapeutic techniques in your own practice?
Well, to answer your first question is absolutely yes. I believe completely that we are definitely seeing a cause and effect with the pandemic and what it's doing to the psyche, what it's doing to our psychology. I was talking to a patient earlier today on the phone, and I was thinking about how we're feeling about this pandemic that we're going through. And I think what's happening is that our society, our world has changed. And I think, if you look at the second law of thermodynamics, we're in that process of the crumbling effects of entropy. And so I think our society that we used to understand and we used to appreciate is changing. And I think we're in the sort of the aftermath of coming out of the rubble and what our new society is going to look like. And I do think as a result of that, we're all in a state of fight or flight right now. If we're talking about trauma, I think that, we inadvertently have been put into a state of fight or flight because of the pandemic. I mean, when there's death attached to this situation, I think it triggers what I call the death circuit. And that death circuit is sort of the fact that we know that we could be imminently in danger of dying. And I think that the PTSD circuits in the brain register that we're in a state of imminent possible death, although we also know as long as we stay home and social distance, that we'll stay safe. So I think our brains are trying to process this new world that we're living in that now has an imminent invisible danger that can definitely trigger a sense of anxiety and panic. And so I absolutely feel that this pandemic is triggering additional anxiety, and that can trigger more depression, not to mention just the economic toll and just the fact that coming out of the rubble of our society, how will our society look once we come out of the pandemic? What will education look like? What will schools look like? What will businesses look like? And I think that inadvertently, that uncertainty for all of us is creating this fight or flight freeze place. Because most of the patients I'm talking to are struggling with energy, focus, motivation, concentration, sleeping too much, eating too much. And I think this is how our bodies and minds are adjusting to this sort of fight or flight. Because really our energy right now is geared toward keeping us safe. So we're amping down on energy. We're not expending as much energy. It's almost like we're hibernating again, so we don't, have a lot of energy to burn up. And I think that our brains are just kind of confused right now. And I think that will trigger more anxiety, more panic, more worry. I think that will also trigger more OCD for people who struggle with obsession and compulsive, especially all of my germaphobes, which ironically are doing quite well during this pandemic. Most of my patients with OCD, my germaphobes who go to the hospital for basically anything, have done pretty well, which is ironic in this pandemic.
So, Chris,
But so I could kind of go on and on, but in terms of treating, it's very complicated. I mean,
Chris, I just want to,
go ahead.
From the pediatrics perspective, I have done a lot of research with the letters from Academy of Pediatrics, World Health Organization, and I get the news that even after this whole thing is over, even like when the schools reopen, then the real anxiety will start. And you probably will agree with me. A lot of other complications, like loss of job, financial thing, loss of friends. They are.
And I think that, aside from the macro changes, I think it's going to be the little subtle changes that we're going to notice, in our society, like going to a restaurant that's now closed because they couldn't survive, having to wait in lines, that we didn't have to wait in before, having to maybe not get a class because now the classroom sizes are shrunk because of social distancing. So, a student might need a particular class that now they have to wait to the next semester to get because of enrollment pressures. So I don't think we know exactly what's going to be the changes. I think we're figuring it out, coming through it. And that's triggering a lot of anxiety and a lot of uncertainty for people, especially students. I have two daughters, both who would be graduating this year, one from the 8th grade and one from the 12th grade. And so I'm really keeping a close eye on them to make sure that they're okay, because they're, this is part of their history of graduating, and it's great. It's been changed, it's been altered. So I'm concerned about the little smaller things, the little subtle things that reminded us of our old society, of our old way of living. We don't know what this new way of living is going to look like when we come out of this. And, I was telling a patient today, it's probably not until we get a vaccine that we will feel a sense of normalcy again.
I was checking with the US news. I believe by October, the Pfizer is making vaccine. So hopefully by October, the vaccines will be ready.
Yeah.
But
so there's actually 3 private American companies and also one institution that are currently in promising stages of vaccine development, and that's Pfizer, AbbVie, and Pfizer, Abbott Labs, not AbbVie, and one more company whose name eludes me, and then Oxford, actually, of Oxford, University, across the pond, as they would say. They're actually in the later stages of a very interesting and apparently very promising vaccine.
Right.
So we'll see.
I think we'll find some tremendous breakthroughs in treating the virus and all of its mutations, right? And I think we'll get back to a sense of normalcy, but I do think it will be altered, it'll be changed. And I think to answer your second question, Dillan, I think in terms of how to get through it, we have to stay grounded. I know we did a show earlier and we didn't get a chance to talk a lot about this, but I think, I was talking about a parallel universe. And I've been, people are like, a parallel universe. Well, maybe it's a better way to put it is thinking about better days ahead and remembering our society the way it used to be, the good parts of it, and kind of putting those two together as a sandwich. What we remember from our previous world, because that's changed now, and what our new world could possibly look like of hope and optimism. Because I do see a lot of positive things happening coming out of this pandemic. And I think it's really about how you frame it and how you see things. Yeah. Do you see this as a crisis or do you see it as an opportunity? Do you see this as an opportunity to come out renewed, refreshed, reconfigured, or do you come out of this with trauma and adversity? So I think it's really about how we anchor ourselves going through this pandemic, because we're all going through cabin fever, and it's all driving us all crazy. So I think the parallel universe.
It's at every level, the parents' anxiety, the grandparents, or at all levels, there's a lot of stress and anxiety.
Right, because there's a lot
Chris,
of
maybe
uncertainty.
to return to your expertise and to hear a little bit more about, your specific ideas, maybe is there any way you could elaborate on the parallel universe as a bridge to discuss these notions of energy medicine, and to maybe share with us how you think specifically, right, procedurally, definitively, we can move forward as the average individual, maybe mental health strategies or perspective enhancers, or even basic tips, like things that people can do every day.
Yeah. Okay.
Maybe any insight into how to synthesize, your own personal experience in your practice with our, the current circumstances that we have, so we can all move forward in a productive manner. Because I feel like there's not enough discussion and not enough inclusion of your perspective, and more importantly, your field's perspective on the global stage right now. It's usually just doomsaying, blah, 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 death toll, this, that, vaccine development so bad, but not enough productive news, right?
This at all is more scary.
Yeah. Well, you ask a very poignant questions, because you ask several questions, and so the parallel universe concept is really more of, and this is more quantum physics, to understand that Einstein said time is relative. And I think what he meant by that is that, we can manipulate time depending on your ability to travel at light speed. And so, not to get off into that too much, but what I took from that was, we can, through our mind power, through our visualization, we can create futuristic stages or states of being that we can draw the energy from that future creation for our present reality. So, for example, when I was working on my doctorate, and I'll be brief, there were many lows that I would hit along that journey, as you could imagine. And so what would keep me going was envisioning graduation day. So my thoughts would immediately go toward walking up on the stage and being handed my PhD. And so I would then go to, well, how does that day feel?
Like a future manifestation.
There you go. Right. And then what I would do in that future manifestation is I would take the energy and the feeling from it now. I know that graduation day is going to be a wonderful, elated day. So why can't I feel that now? If time is irrelevant and me graduating is not negotiable, then why can't I live in the feeling of the graduation? Why can't I live in the completion of it? And when you start to focus on living in the completion, it's a much different chemistry than living in your present reality. Because, it reminds me of a song that was called Better Days Ahead. And so, when I remember listening to that song, it was a very uplifting song because it pictured, it gave you this image of the better days ahead. And we all know there are going to be better days ahead. So why can't we live in knowing those better days are coming versus the reality that people are dying every day and, numbers are going up and those kind of things. So that's that parallel, that universe concept. So and I also kind of frame it as sort of living in a state of denial a little bit. Denial is something that I really deal with in the office, but right now it might be a helpful adaptation, to be in somewhat denial of the realities of what we're dealing with. People are dying. I lost a good friend of mine 2 weeks ago today, 40 plus year friendship. And so it's real, and that made it real for me. So to kind of think about future days and being able to go to concerts again and restaurants again and hugging your friend and touching people again, that's what we can focus on. And I think by projecting future, it helps us deal with the present. And that's sort of that parallel piece.
Thanks a lot for those words. I think that's really beautiful. First of all, I'm sorry about that. I'm sorry for your loss. It's terrible to hear. Not a lot of people know of people who are directly afflicted or affected.
Yeah.
It's really unfortunate.
Well, Michigan and Detroit especially is a big hot spot.
Yeah.
And
I was checking today, Michigan, especially even in Oakland County, Chris, around us, there has been so many cases. So, Dillan, to answer your question, from as a pediatrician, you have to be calm, cool, and always think positive. Think about you will finish your exams and you will go to the medical school, and that is a dream, right? So the dreams are high, and you ask for it, and you work towards it, right, Dillan? You agree with me?
Right. Yeah, I think that's one of the ways to frame.
And dreams are free, right? Dreams are free. So
yes, no one can take you. No one can. That's how that works, because nobody can predict your future, not even your negative alter ego thinking mind. So you can have fantasies and you can dream, because nobody can tell you that that's not going to happen, because nobody can predict the future. And so Tage, I want to get you back in the conversation a little bit. So you're representing the K through 12 sector, the high school sector. So going back into school in the fall, what are some of your concerns? What is some of your classmates' concerns about how this is going to affect you guys?
Well, I'm concerned personally about, I know there's been a lot of job loss in the country, I mean, over 30 million jobs were lost in April and whatnot. And so I'm worried about what the economic implications will be in relation to who's going to be coming back to my school, because over 70% of Americans live paycheck to paycheck. And I don't know if any of my friends are like that, And so, and I obviously hate for them to have to go to a different school district, have to move and then in turn not see them. And so I think that one of the biggest concerns right now is basically, will we be able to see our friends, or are we not going to be able to, due to, like, let's say it's a family of 4 and only the dad works, and let's say they're living paycheck to paycheck, right? And Bloomfield Hills is a pretty expensive area to live in. And so let's say the dad loses his job, and then what will happen to that family, I mean, they're probably not going to be able to live there.
Sure.
And what if they're your friend, And so that's a pretty big issue. And
I mean, that's the collateral damages that I think we're going to start to pick up and start to hear about, and so I think that's when you just have to reach out, stay connected through technology and social media to kind of stay connected to friends. There's going to be a lot of transition, a lot of changes, and a lot of things that I think, that's that grieving. I think a lot of us don't realize it, that we're grieving. We're grieving the change in our world. We're grieving the change in our society. Things are not going to operate. When you go out and go to stores and you go shopping, social distancing, long lines, and just all kind of changes. And I think I recognized that today as I was shopping a little bit, that things are just different. And I think I was grieving, had a very melancholy feeling about just the life we used to have is kind of gone, at least for right now. And I think so that's triggering that grief that we're all feeling. People's jobs are lost, so people may have to move and relocate, and it can affect your classmates and who's going to be in your class next year and things like that. So that's the uncertainty that I think nobody can predict. And we really don't even know what all those things are going to be just yet. So I think we have to stay connected and communicate.
Yeah, thank you, Dr. Shreve.
Yeah, Dr. Prasad, what do you think in terms of the medical and immunological, virological effects of going back to school? What are your concerns, you think, with kids going back to school?
This is a very good question, and I did a lot of research on it. When they go back to school, most important thing is, like we talked about, maintaining the distance, personal cleanliness and all that. But one other perspective, they should have etiquette immunization. Like, as we know, during 2019, there were so many cases of flu, H1N2. So many kids died from the complications of flu. So I think it's very important for the parents, the caretakers, for everybody to make sure, that kids are fully immunized, they are in the good health. and just keep them motivated. That's the only thing I can suggest. Academy of Pediatrics have come out with the new guidelines, but the guidelines will start once the school opens. So now we don't even know when the schools are going to open.
Right. Yeah.
Some of them may not open, Chris. So that's the thing.
Yeah. And I think that's the issue that, you know, folks who are in school are concerned about. You know, what will school look like? Will we have regular classrooms? You know, what would gym look like? You know, will we have, you know, some of the basic things that we took for so granted? You know, I think a lot of stuff we took for granted, we're now really realizing how much we appreciated those simple things, you know. And so I think, though, you know, I'm an optimist, and living in that future reality, in that parallel universe, you know, I think that I'm projecting nothing but positive things coming out of this pandemic. You know, I think there's an opportunity for us all to come out reinvigorated, refreshed, renewed, re-energized, because we all got a lot of rest. And some of us are still very busy, but many of us are getting good rest that we needed. I think this is the opportunity that many of us haven't had, to take a time out, to come to a stop, to just stay stopped for a while, to not have to worry about the stresses of jobs and necessarily school right now, and just get back to the basics of family, friends, and what's important. And I think that's the good stuff about this pandemic. Besides, I think we're going to have a much cleaner society, you know, with all these new protocols of cleaning restaurants and businesses and schools. I think, you know, they were talking about that's going to help kill the influenza in the fall, not the corona, but the regular flu, because of our change in hygiene. You know, hand washing alone will save a lot of lives with the regular flu. Yeah. So if we stay with these practices and know that practicing these protocols will keep us all safe, that should reduce our mental health problems.
And Chris, I am depressed myself because I was so active before, working, going to all these hospitals, and now I'm just staying home.
Well, I think, and I'm sure Dillan and Tage can agree with this, that we have to create a new active.
Right, yeah.
You know, I notice now when I get up out of the chair, I'm stiff and I'm aching, and that's never happened. And it's because we're not moving. Right. We're not moving around. And so our bodies are designed to stay in motion. Yeah. So I think that we have to figure out what that new activities are from being in a quarantine environment, you know, and it's very different, you know, and our bodies are trying to adjust to what we're going through because our bodies don't have a precedent for this and our minds don't have a precedent for this. So yeah, we could be triggered a lot of anxiety, a lot of depression. People are having a lot of weird dreams, you know, because we're all getting too much sleep and we're staying in REM sleep for longer periods of time. So that could trigger more depression, more fatigue. So those are things that we really have to watch out for while we're getting through this.
I have started watching late movies.
Okay. Yeah. I mean, it gives us time to really do some time outs and get back to the basics.
Yeah, because it's
so, yeah. So Tage, Dillan, I know time is probably going to run out in a few minutes. Any other thoughts?
We actually have limited time.
Okay, Dillan, do you have anything else to add to the whole thing?
Yeah, I was just going to ask, with respect to our sedimentary, you know, lifestyle right now, not much movement at all, mental or physical. I was going to ask Dr. Shreve, do you know how that explicitly connects back to things like, to, you know, mental conditions? Do you know if
absolutely
a strong implied correlation to the development of such conditions?
Oh, absolutely. Mind-body connection. I mean, you know, there's obviously tons of research that connect the mind and body. So the brain is really the center. And I read some research recently that said the heart was the center of everything. I'm still reviewing that. It's very compelling research. But nonetheless, the heart and brain, everything is integrated in the body. So certainly we are one integrated system. So what we're going through isn't going to be processed in our minds as well as our physical bodies. So I think right now, which is where people are really struggling, our energies are off. We don't even, some people don't even want to, and I don't know if that's the trauma thing that's gotten triggered, but a lot of us are in avoidance. We're either not looking at the mail, we're not talking to people, we're like sleeping too late, we're isolating. So I'm not sure if it's trauma or if we're triggering, more symptoms in the body from this fight or flight that we're in. But I think that we have to push through and do our exercises. We have to go for the walks. Now that the weather is breaking, I think after this phone call, I'm going to get on my bike and go for a quick bike ride.
Great idea.
Yeah, because we've got to make up for. We're not walking. We're not doing the basic things that we were doing.
Yeah.
So it's going to catch up with us. Absolutely. And the older folks is catching up quicker.
Thank you for that insight.
Okay.
Yeah,
Absolutely.
Thank you. We don't have too much time, so I will send you guys the articles that I have written as an attachment. I just wanted to share this picture of the Kawasaki disease. And this is the mysterious illness that has been described in the children, New York hospital, and 15 or 20 were COVID positive. Eyes are red, and they have a hardening of the coronary arteries leading to chest pain, even heart attacks, rash on the body, strawberry tongue. So it's very scary. And the sad thing is there is no treatment for this. It's self-limited. So scientists are trying to find a treatment for this Kawasaki syndrome, which is linked to the COVID-2, but now there is, as of now, no treatment.
Well, I think all that information is just, in vain. It goes to show that this COVID-19 crisis has a whole host of other complications and confusions and displacements that affect our mind and our body and our well-being, not just as individuals, but as a society as well. So I think it's very important just to stay cognizant, not necessarily of the specific examples, but more so the macro scale viewpoint, right? The broader picture, keeping that parallel universe and that future time in mind where we can all feel, happy and engaged again.
Okay, one last minute note from Tage. Tage, you have anything to ask Dr. Shreve?
Yeah, Dr. Shreve. So I know that you mentioned how REM sleep among individuals is most likely increased due to not having as many things to do during the day. And so I'm wondering, how do you think that sleep patterns of individuals will be impacted by the coronavirus after everything returns to normal?
Well, I think, with most things, they'll return to normal. Once we get back into a more structured activity life, much of us are just kind of freestyle. We're just kind of waking up, eating when we want to, check in class when we want to. It's very ad-libbed and very flexible right now. So I think it's a good thing right now. I mean, my daughters are sleeping till 12 o'clock in the afternoon, 1 o'clock, And so when I'm eating lunch, they're ready for, I'm eating dinner, they're ready for breakfast. So I was a little worried about it, but now I'm like, all right, whatever. Because once we come out of it, we're going to come out of it, and we're going to come out running. And we're going to get back to our lives, and we're going to pursue it, and we're just going to get moving. So enjoy the downtime, guys. Get to sleep. Get your sleep on. Enjoy it, because once we come out of this, we're banging.
Okay, Dillan, one last minute note for all of us.
You actually have unlimited minutes, Nani.
No, because we are running short of time now.
Okay. Well, I think I said most of the things that I had to say, but I just wanted to, thank everybody, especially, Dr. Prasad and Dr. Shreve for contributing your perspective during this time. I think it's very enlightening and enriching for the young people in my age demographic and in Tage's age demographic to understand that, there are bigger forces at play here.
Sure.
And there's a lot going on that is really outside of our control. A lot of bad things in the world, but there's cause for optimism on, the immunological and virological front, and also on the emotional and psychological and, atraumatic front as well. And I think if we just synthesize those fronts, stay optimistic and keep a healthy outlook in everything that we engage, then we will all be able to move out of this together. So I really
I
appreciate
couldn't have said that any better myself, Dylan.
Yeah, thank you. Thank
Right.
you. And Chris, when are we going to meet again? The top 10 mental illness 2019, 2018.
As
And
soon
now
as we get
with this COVID.
we'll be back in the studio probably in June, I imagine.
I think
Hopefully.
so. Yeah, yeah.
Right. I'm ready to get moving. I've been sitting still too long. I'm ready to get going.
Thank you so much.
Sounds
for
good. Hey guys, if you want to do this again and just add more friends, we could do a big forum, and we could do a larger question and answer session. You know, if you guys want to set that up.
Thank you so much to all of you, and everybody have a wonderful weekend. Thank you.
Yeah,
Okay, take care.
Thanks.
Stay
Bye-bye.
safe.
All right.